Welcome to this explainer. I am absolutely thrilled you're here with us today because, honestly, we're going to completely change the way you look at a sterile compounding facility. You see, we aren't just walking into a laboratory or a regular pharmacy here. We are treating this facility like a literal fortress, a fortress that's designed with one singular, uncompromising purpose: to protect vulnerable patients from microscopic threats. And in this 2026 updated contamination gauntlet, let me tell you, the defenses have never been tighter, and the protocols have never been more exact. So get ready to see the garbing and hand hygiene sequence not as some mundane daily chore, but as a meticulously designed series of defensive walls. Now, I want you to just look at this number for a second. 1 million. It's a pretty staggering figure, isn't it? You might be wondering what exactly this represents inside our sterile fortress. Well, brace yourself, because this is the number of squamous skin cells your own body sheds every single hour. That's right, 1 million microscopic skin particles constantly falling off of you, and every single one of them is completely covered in microorganisms. So, in the context of a sterile compounding environment, you're not just a technician or an operator, you are an active, walking threat that's being brought right into the workspace. Your very presence is the hazard we are trying to engineer away. So the crucial point is that human touch is the ultimate enemy of a compounded sterile preparation, or CSP. I mean, think about it. Despite all of the incredibly advanced technology, the high-efficiency particulate air filters constantly running, and those meticulously pressurized clean rooms, the single biggest risk to the product, and ultimately to the patient sitting in a hospital bed, comes from our own hands and bodies. If we don't master the physical interaction between ourselves and the environment, well, all those million-dollar engineering controls are completely worthless. All right, before your physical journey into the suite even begins, we really have to lay down the absolute baseline rules. Think of this as basically shedding your outside identity. All those personal items, your cell phone, your earbuds, your keys, they must be locked away in lockers completely outside the clean area. Absolutely no makeup is permitted, and that's because cosmetics actively flake off these microscopic particles all day long. The exact same goes for jewelry, which, can harbor hidden bacteria, or even worse, puncture your sterile gloves. And your nails, they have to be impeccably clean, neatly trimmed, and completely free of any polish, artificial extensions, or overlays. No exceptions. Now, these seemingly small details might feel a bit restrictive at first, but ignoring them can literally compromise the entire sterile environment before you even take your very first step inside. Okay, stage 1, the outer perimeter. Let's look at the activities you need to do right prior to entering the gowning area. Okay, let's dive into this first geographic stage of the 2026 garbing sequence. We're starting out at the outer perimeter. This is exactly where you prep your body before you even cross the threshold into the gowning area itself. At this stage, you're basically putting on your initial layer of defense. First things first, you've got to change out of your street clothes and don hospital-issued restricted scrubs. And no, you cannot wear your own comfy scrubs from home. These are strictly controlled by the facility. Next up, you throw on a white lab coat right over those scrubs to protect them as you move through the unclassified, regular areas of the hospital. And finally, if you have long hair, it must be securely tied back right now. You want to make absolutely sure nothing is hanging loose before you move into those restricted zones. Moving on to stage 2, the first defense. We are now stepping inside the gowning area. All right, we are stepping deeper into the facility now. From here on out, every single movement you make needs to be highly deliberate, precise, and methodical, as we actively begin to lock down that massive 1 million cells per hour shedding rate we talked about earlier. This stage is entirely about locking down facial and hair particulates. First, you'll don your head cover, taking extra careful care to ensure that every single stray hair is completely enclosed. If you've got any facial hair, a dedicated cover goes on next. Then, secure your face mask, making certain it tightly covers both your nose and mouth to trap all those tiny aerosols from your breath. Finally, we cap this critical stage off with an initial chemical sanitization of the hands. Just a good pump of hand sanitizer to knock down that transient microbial load before we proceed any further. Up next is stage 3, crossing the border. This covers the anteroom and the critical line of demarcation. Now, listen closely, because this is the most critical physical transition in the entire sequence. You are entering the anteroom and facing down the line of demarcation. Now, this isn't just some piece of colored tape on the floor. It is a hard border. It completely separates the unclassified, dirty world you just walked out of from the highly classified, pristine environment where the actual compounding happens. Crossing this border requires a very specific physical maneuver, and this brilliantly illustrates how physical space is literally engineered to prevent contamination.
You walk right up to the visible line, but you absolutely do not step on it or over it with your bare shoe. Instead, you balance on one leg, don a shoe cover over your lifted foot, and only then do you firmly place that covered foot on the classified side of the line. Then, you repeat the exact process with your second foot, smoothly transitioning across the border without ever dragging unclassified floor contaminants into your clean space. Once you're safely across, if you happen to wear eyeglasses, you must immediately wipe them down with the provided wipes, because honestly, glasses are an absolute magnet for dust and skin oils.
Okay, with the line successfully breached, you'll move over to the sink to prepare for the surgical hand scrub. Now, I really need you to pay close attention here because the 2026 update has introduced a very strict mandate. Do not use nail brushes. That's right, those harsh brushes we used to use can actually cause microscopic abrasions on your skin, which ironically end up encouraging bacterial growth. Instead, you must run warm water and use a specialized disposable nail cleaner, a little nail pick, to gently and meticulously clear out any debris trapped underneath your fingernails. Once those nails are totally clear, the official countdown begins. At 0 seconds, you apply your soap and warm water, beginning a highly systematic scrub. And you don't just wash your palms here. As you hit that 15-second mark, you should be methodically working your way down your forearms all the way to the elbows. You have to maintain this active, rigorous scrubbing action for a full, uninterrupted 30 seconds. Finally, as you reach the 40-second mark, you rinse and then thoroughly dry your hands and forearms. But remember, and this is key, you must only use low-lint disposable towels or wipers for this. Mechanical air hand dryers are strictly forbidden in this space, as they basically just blow turbulent, potentially contaminated air directly onto your newly cleansed skin. Definitely not what we want. Let's pause our physical garbing process for just a quick second to really understand exactly what we just did at that sink. We need to clearly distinguish between cleaning and disinfecting. See, what you just did with the soap and water, that was cleaning. It's the mechanical, physical removal of dirt, skin cells, and random debris. You physically wash the threat right down the drain. But disinfecting is a whole different ballgame. Disinfecting relies on chemical agents to actively hunt down and destroy the microorganisms. We're talking the fungi, the viruses, and the bacteria that might still be stubbornly clinging to the surface of your skin. To make our hands truly safe for the clean room, cleaning alone just isn't enough. We absolutely have to follow it up with disinfection. Let's move to and see how this builds into donning your final sterile armor. With your hands now physically clean and completely dry from the towels, you step into and don your sterile gown. Next comes that crucial chemical disinfection we literally just talked about. You apply an alcohol-based hand sanitizer directly to your bare hands and wrists. You must rub them together vigorously, covering every single surface, until your skin is entirely 100% dry. If you try to slide gloves on while your hands are even slightly wet, the alcohol simply cannot finish its chemical destruction process. Once your hands are bone dry, you carefully don your sterile gloves, making absolutely sure they are the correct size to prevent any catching or tearing while you're right in the middle of compounding. But putting on this awesome armor is really only half the battle, right? You have to constantly maintain it. Your final and ongoing daily defense is sterile isopropyl alcohol, or IPA. You must aggressively spray your gloved hands with sterile IPA immediately prior to reaching into the primary engineering control, which is your laminar flow hood. And listen, this isn't just a one-and-done morning routine event. Every single time your hands leave that hood to grab a quick supply, check a medication label, or even just touch a counter, you must spray them again before you re-enter that critical compounding zone. It's constant vigilance.
All right, almost done. Here is the exit strategy: reversing the process safely. So you've successfully completed your compounding for the day. The IV bags are perfectly labeled, and your shift might finally be winding down. But your vigilance doesn't end just because the compounding is done. Leaving the cleanroom suite requires its own exact protocol, because honestly, taking the armor off incorrectly can be just as hazardous to the facility's baseline cleanliness as putting it on wrong in the first place. As you exit back into the anteroom, you will carefully remove and discard your sterile gown and gloves into the designated receptacles. They've done their noble job and are simply no longer sterile. Then, you grab your hospital-issued lab coat and put it back over your restricted scrubs before you walk out into the general hospital hallways. But there is one absolute 100% non-negotiable rule you must always remember. Under no circumstances can those hospital-issued scrubs ever be worn out of the building. They stay inside, ensuring that the dirty outside world and our pristine inner fortress remain forever separate. Which brings us right back to where we started today. 1 million microscopic skin cells falling from your body every single hour. The rigorous procedures, that strict line of demarcation, the new surgical scrub updates, the sterile armor, it is all meticulously designed to contain you. The gauntlet is set. The protocols are incredibly clear. The only question left for you is, will your aseptic technique hold the line today? Thank you so much for diving into this explainer with me, and I challenge you to view every single step of your garbing sequence with the profound respect it truly deserves. Catch you next time.